Hello, this is Rico Cavella, and this is your Fearless Aging podcast, where in every episode, my guests and I, we strive to offer you proven tips and strategies that you can begin to implement immediately to help you live a healthier, more energetic, vital, successful, fulfilling, long life and never get old. So we're here to inspire you and empower you to become your best self so you can go out and make a bigger positive difference in the world. And I'm sure you know we desperately need more people to step up and make a positive difference in the world today. So I'm really excited about today's episode because we're going to talk to a great expert, and we're going to learn all about some of the latest in anti-aging and regenerative medicine and stem cell and spinal disc regeneration. So this is going to be one you really want to pay attention and stay with us for the time. But before I introduce our great guest, I want to let you know again that if you've been struggling with maybe sticking with a healthy eating or an exercise program, or maybe you don't even have a program and you know that you're not as fit and as energetic, as healthy as you want and need to be, and maybe you have some premature aging going on, I've got a great solution for you. In January of 2023, we're going to be offering a new, what we call an adventure wellness vacation. And this is going to be 6 days spending in a tropical island where you can relax and let go of all the stress, and you go and have a good time, a nice vacation. But in that same setting, we're going to develop your personal ageless living lifestyle, lifetime wellness system that you can take with you and implement easily at home, and so that you can get and stay healthy and energetic and vital all your life, because that's what is natural for you. So if that's of interest to you, go to agelesslivinglifestyle.com/vacation. So our guest today is Jeffrey Gross. He's a board certified fellowship trained neurosurgeon. He's the owner of Spine, which is a regenerative medical practice, and a regenerative medical practice called Recelebrate. I love that. And he sees patients in Orange County, California, Henderson, Nevada, as well as remotely by computer video conference. In his practice, he offers specialized precision and concierge treatment options for patients with neck and or back problems, as well as brain and head injuries. He provides a comprehensive approach to evaluating the pain generated in the spine and associated areas, and digs deeper to find the source of the problem when identifying the root issues of persistent pain and injuries. Dr. Gross employs regenerative medicine and other non-surgical options first and foremost, and he is an internationally recognized expert in these fields. Dr. Gross, thanks so much for being here.
It's my pleasure and my honor. Thank you for having me on the show and for having this opportunity to meet with you and anyone who's listening. Thank you so much.
Yeah, thank you so much. So this is going to be really, really helpful. And like I say, I have a spinal condition that I want to talk about too. I think maybe you have some ideas for me, and I think it will help other people as well. But before we get into all that, first tell us a little bit about your journey, how you decided to become a neurosurgeon and how all that took place, and then how you developed into what you're doing today.
Well, thank you for the opportunity to tell my story. I'm a frustrated scientist. I have a degree in biochemistry and molecular biology from Berkeley. And then I shuffled right off to medical school at the George Washington University School of Medicine and did my training in neurosurgery and a spine fellowship and went into practice. And for 20 some years, sort of got in a path, a tunnel of helping people with brain and spine problems, having this longing for that very basic science that I learned in college, the molecular biology. And so much had changed, and I wanted to update myself. So a few years ago, I went back and said, I'm going to learn this stuff. There's some great stuff happening in molecular biology, and it turns out there's gene editing and there's stem cell knowledge that we didn't have 20 some years ago. So I didn't want to keep practicing like I was trained in the 1990s. I wanted to bring the modern knowledge to the modern practice. That's still not even being fully taught if you're a resident doing your medical training right now. So I wanted to move fast forward and bring some of the latest cutting edge regenerative medicine techniques to not only what I do in the brain and spine, but also to many other areas that I've expanded to, and I didn't intend to, but now I address all kinds of different problems and help people heal. And this has moved into an entire practice on anti-aging, where we slow and possibly even reverse some of the effects of aging at the cellular level, and slow disease, reverse disease if we can, and work towards, like you said at your opening, a longer, healthier, useful life, not just lifespan, but health span.
Exactly, health span. That's so well said, and I really appreciate what you're doing. And yeah, not too many people, make that effort to really. It's so easy to get locked into what you're doing and just go along with the thing. And but so I really appreciate your work and what you're doing, and it's such an important topic. So I really appreciate that. So, well, let's just get going then. So let's talk a little bit about what are some of the latest anti-aging and regenerative medicine things that you've been using and learning about.
Well, I've tried to incorporate what I do, and when I talk to people now, when they sit in front of me for a nice long consultation, concierge kind of level, is we break it down to lifestyle, behaviors, supplements, diet. As I was telling you before we started the broadcast, it's not just what you eat, it's when you eat it, and what those timeframes look like. I also discuss some cutting edge pharmaceutical options with people, bioidentical hormone replacement, and as well we get into the more we call the biologics, which would be PRP, stem cells, and then the really exciting project is now probably more advanced regenerative, is using the small stem cell activating particles. And those are called extracellular vesicles. Some people call them exosomes, which I might use that term. And these are what we're using now to try and address and help healing and age reduction strategies.
Yeah, well, that's really what epigenetics is all about, right? That we know that our genes can be altered and affected by our external and internal environments. So I talked a little bit about how that works and what a difference that's made in our knowledge of how to treat illnesses.
Right. So for anyone, a new listener perhaps that doesn't understand that phrase or that word epigenetics, we break our cellular programming down to two main factors. It can be looked at through different ways, but this is one. Genetics, meaning what you're born with, your genes, what genes you got. Are they all good? Do some have mutations? What have you? But it turns out perhaps maybe 80% of our cellular behavior, cellular activity, cellular programming, which I hope we circle back to, our health at the cellular level, is based on what genes are actively being used. Transcribed is the word we use in biochemistry, but meaning what genes are busy, what programs are running. And that is significantly determined, perhaps 80%, by our behaviors, our lifestyles, our diets, when we eat, how we eat, our circadian rhythms, our supplementations, our mindset. Do we have a healthy mindset, or do we relax? You talked at the outset here about your wonderful idea to have a wellness retreat of sorts. I mean, the mental peace leads to cellular peace, and that cellular peace leads to better programming. And if I can circle back a minute to my journey, and I know I'm getting off topic.
No, sure.
When I finished my training as a surgeon, and it was 1999, someone told me a statistic that surgeons have an average life expectancy of about 68 years.
Wow.
Now, it's hopefully a little longer now. But
because it's so stressful? Or what?
That's what I thought. I thought these guys aren't sleep. I'm not sleeping at all. Even on the 1 and 3 nights where I actually get to go to bed, I wasn't sleeping. I wasn't dreaming because I was waiting for, remember beepers? I was waiting for the pager to go off. So, after a few years in practice, I cut out taking calls so much, and I was able to develop a lifestyle. Hopefully I'll live a little longer than 68. So I have that interest renewed now in the anti-aging medicine. And most of it, circling back to your question, is the epigenetics. It's dealing with how do we impact the genetic programming of our cells, what genes are being active. I want my anti-inflammatory pathways going because that's a youthful pathway. I don't want inflammatory, degradation, degenerative genes active. Those are the aging genes.
Yeah, so so the good news here, I think, is that, in the past, people just kind of bought into that. Well, this is just genes I got. That you could use that as an excuse, right? Well, I'm overweight because I got bad genes, so you can't use that excuse anymore. But the good news really is that no matter what what health challenges we're dealing with, there are solutions, and there's a lot that we can do, and our body is actually meant to regenerate and heal itself. That's just really good news, isn't it?
You couldn't have said that any better. We have the programming to repair our own DNA. We have the programming to heal and regenerate. And one of the reasons that I was so interested in this is you think about, Rico, do you have grandkids?
No, I don't.
You do? Okay, well, I do. And if you ever see them fall down and scrape a knee, 72 hours, that is scabbed and gone, they're healed. But you and I fall down and bruise an elbow, and man, 3 weeks later, it's still finally getting over the discoloration.
Right.
How come we can't heal like that 3-year-old? It turns out it has to do with this whole idea of healing and regenerative medicine and the biologics and the cellular programming. The less exposure that 3-year-old has to environmental toxins and stuff in our food and all kinds of things. So I'm doing everything I can to get the word out, as you are, to people, that there are things you can do. In fact, there are simple things you can do if you don't want to get too fancy, from taking the right supplements to eating, and it's okay to have pizza night, but you try to condense your eating window, and it's called intermittent feeding. And things like that. I mean, there are very simple things you can do that are lifestyle changes, as you said, called epigenetics, to focus on cellular activity that is regenerative, which is anti-aging.
Yeah, that's so good. And again, I just want to emphasize that, we're not part of, we're not victim of our genes and all that, but what we are victim of is our unhealthy lifestyles and not being aware of how we are affecting our health, and that we need to take responsibility for our health, and we can. And that's such an exciting field, and there's so many things that we're learning about. Well, I'd like to get into this for a moment, but you talk about, you do some spinal health and some spinal regeneration. I'd like to tell you about what I've been dealing with and what some ideas you have, because I think probably a lot of people have the same thing. About, well, maybe 6 or 7 years ago, I was a pretty hardcore cyclist, and I had a really bad cycling accident, and I got a herniated disc at L4. Okay, herniated, and it really wouldn't cause me that much pain or anything. But then a while later, I got just for about 2 or 3 days, I got a really severe case of sciatica. It was so painful, and then it just went away. But it left my lower leg, my right side, my calf, all my lower leg numb, and then it just left. So and then my whole right leg, the muscles just always, if I do too much, it spasms out, and it always kind of hurts. And so I know I've got some nerve damage in there, and I'm not getting the nerve innervation and the oxygen to my leg. And I've tried so many things, all these years, and I haven't been able to regenerate my leg. So you have any ideas about that?
Absolutely. Okay, if we define a few terms for the audience.
Sure.
All right. So the first thing that caught my attention is you said you got a herniated disc, and it only hurts sometimes. So the important thing here is we as spine doctors, putting my spine doctor hat on, we treat the problem. So in your case, it would have been back pain at that point. The herniation may have been the cause, but if someone comes in and they have no pain and no nerve problems, we're going to keep an eye on that herniation, give them some preventative things to do. There's no reason just to do something to a herniation if it's not causing much trouble. Okay.
Right.
So your back pain sounded like it came under control, maybe because you're fit, you're lean, you have good core muscles, and by
Right.
core, I don't just mean your abs, I mean all the way around your body.
Right.
But when you started getting like you said, the nerve symptoms, and you use the next word we need to define is sciatica. The sciatica is an old-fashioned term that means irritation of the sciatic nerve, and the sciatic nerve goes from the low back down through the buttock into the back of the thigh and branches out. The sciatic nerve is made up of a bunch of individual nerves that come near the discs in your lower back. So the word sciatica doesn't mean it's a problem with that nerve. It could be a problem with one of its source nerves. Okay. So for example, you said you got an L4 herniation. You probably mean L4-5.
Right.
Because it's the disc in between the two bones.
Yes.
Right. Okay. So when that disc is causing trouble, nearby that disc is one of the, and in this case, I think you said it was your right side.
Mhm.
It could be your left side, it could be both sides, depending on the nature of that herniation. But it's either compressing or chemically irritating and inflaming. You heard that word inflammation again. Inflaming the nerve, giving you symptoms of some pain into your glutes and down the leg, which is a form of which you call sciatica. You can also have numbness and tingling, which I think you mentioned.
Yeah.
And then when the nerve is irritated, it can spasm into the muscles because the branches go to muscles, they go to the sensory parts of the skin and deeper. So you're having all those symptoms.
Exactly.
And it's likely, all this fits together. It's likely that herniated disc, which we can also call, a layperson might call a slipped disc. Okay. So I think you're 100% right. That, it sounds like you know what you have. It's a common thing. You were injured, which is a common cause of a herniation. And then what do you do about it? Can you regenerate it? And that's really finally getting to the question here.
Yeah.
And well, first, let's say you've maximized everything that's traditional. Your weight is good. You've done the right therapy and exercises. You've maximized that.
Yeah.
You've taken all the right vitamins and supplements, and nothing else can be done. And let's say hypothetically you had an MRI scan and all it shows is that one herniated disc. So we really don't need to do any confirmatory steroid injections or numbing injections, which we do sometimes. Some people have multiple findings on their MRI, and we want to pinpoint where the problem is.
Oh, I just might say, I did even try that once and it didn't seem to do anything. I've tried acupuncture, chiropractic, even some energy healing, and like I say, all kind of muscle rehabs and stuff. And
Yeah.
I'm still hanging in there. I can function, but not nearly as well, so it's just been, like I say, it's been, and I talked to a surgeon, and he said, well, but this was not until about 3 years later. So he says, well, we could probably go in there and clean up maybe the disc a little bit, but since it's been already about 3 years, I don't think it's going to help your numbness. I don't know if it's going to really do you any benefit. So that's where I'm at.
I want to address some of that if you don't mind, because I think this is a good, hopefully people learn from this, but take me back to the injection that you did have. Was that injection specific to that L4-5 disc herniation?
Yeah, I think so. And it didn't seem to help at all.
Did it give you even some very temporary benefit?
Yeah, I do remember that. This has probably been a year or so, a couple of years ago. I remember again, my back doesn't really bother me much. Sometimes it'll get a little start, but I remember my back did feel like it was more relaxed for just a couple of weeks. It felt a little looser in there, but it didn't seem to affect my leg in any way.
It didn't?
No.
So what I would really be looking for, if you did have an injection at that spot, like really at that spot done right, for some temporary benefit, to confirm that is the cause of your leg problems, because it's possibly not. And before you did anything, I'd want to confirm that, because if we start out with the wrong source of the pain, then the treatment could be wrong. We don't want to do that. So for the purposes of this educational discussion, let's assume you had 2 days where the numbing agent kind of helped your leg symptoms. Because I'm hearing you, your leg is the bigger problem, even though we agree that oftentimes this comes from the lower back, right? So then you mentioned that the surgeon said that we could go in and shave down the disc or clean up the disc a bit, but he was worried, or she was worried, that 3 years later it was too late. And I might take a different tact at that, and the different tact, and I don't mean any disrespect, is if you had the problem start after your injury and it's been intermittently ongoing since then, or persistent or progressive in your case, and still there, why wouldn't cleaning that up have some benefit?
Okay. Well, you know,
And again, I would tie back to the right injection because I always believe if we can put some Novocaine in there, Novocaine-like substance, and you have a wonderful day, like, oh wow, my leg pain's been gone for the first time in a while. If we can get it better for one day, we can get it better for 2 or a week or a month or a year, and that could require a small procedure to clean that up. Now we haven't even got into the regenerative options, which are very new and cutting edge. And just as a disclosure, these are not yet approved by the FDA, although they are regulated by the FDA. So they've got a little bit of a limbo going on there. They're saying we're in charge, but we don't know yet if we're approved. It's not unapproved, but it's also not approved, right? Okay. So the next step would be to look at regenerative options, and many things have been tried. I just finished a textbook chapter on this topic, and people have tried platelet-rich plasma, and I'm happy to discuss that with your audience if you prefer.
I actually had some of that. I did have
Okay.
some platelet, because I have a friend who does that, so I got a really good deal on it. And again, it just didn't seem to affect my leg at all.
Okay. And where did he deliver the PRP, the platelet-rich plasma?
Let me see. That's been a few years ago too. Well, I think in the back, but I'm not sure. To tell you the truth, I think in my back, yeah.
But hopefully near that herniated disc, not just sort of random.
Yeah, I'm not sure, but
Right.
I assume they know what they're doing. I don't know.
And then we got to look at stem cell options and disc regeneration options. Disc regeneration will not help the herniation go back in though, so that needs to get looked at. Given the fact that you did not respond to the platelet-rich plasma and did not respond even temporarily to an epidural type steroid injection, assuming they were done right at the spot of the problem, I'm concerned you may have another source of symptoms, and sometimes it can be from the sciatic nerve, or it's a different spot in your back. So, if you were someone who I was looking at, I would say, let's take a look at your MRI. If it's been a number of years, maybe get an updated one. Do a really good exam, check out your leg and all those spots, tendon spots, and make sure we know where it's coming from first and foremost. Because I don't want to do anything until we know where it's coming from. And doctors aren't perfect. We got to give it our best shot. Say, I think more likely than not, it's coming from this spot or these spots. Sometimes it's more than one.
Okay. Yeah. Well, maybe I could sometime when you're in Orange County. Maybe I can come see you. Maybe
I would love that.
I'll have to do that. Yeah. Well, tell me a little bit about. We talk about spinal disc regeneration. What is that?
Yeah. So the holy grail of disc degeneration, which is where the discs lose their height and lose the cushioning power, and we start to form bone spurs as a result. The holy grail of that is restoring the disc, and restoring it without a massive surgery or screws and rods, which I've done plenty of, and I'd like to do less and less if we can have these new techniques. The holy grail is restoration of that disc. Turns out we have the programming in our bodies. Our cells know how to lay down more collagen and lay down the type of proteins that those discs have. And those discs have type of proteins that suck in water. And just like your kitchen sponge, Rico, at home, when you just use it, it's moist, it's squishy, like we want our discs. Well, when you've gone on a trip and you come back and it's all dried out and hard until you wet it again, that's a degenerated disc, right? It doesn't have a lot of cushioning. Well, we need that cushion. We're on an air ride break up and down our spine. We have 30 some vertebra and 30 some discs, right? So we need to keep those in their best shape. And this is why, also the degeneration and loss of height is why, as you get older, you lose a little height. That's the main reason.
Is that called spinal stenosis?
Stenosis is when you form the spurs and it gets narrowed where the nerves are.
Okay.
But it can be a result of that vertical, the vertical compression can go hand in hand with the horizontal expansion, which takes up the space of the nerves. That's stenosis.
Okay.
That's when the legs tend to get involved. But the holy grail is restoring these discs. And it turns out there's been a lot of work done on this, that there are a couple of methods. And most of the earlier methods over the last 20 years are injecting into the disc. And they're okay. They have some decent results. The problem is the discs don't have cells. They have a few, but really the disc is a rubber stopper. It's a gasket. It's a cushion. It's cartilage and tissue. It's not cells. So how do the discs get their health? They get them from the vertebral bones. The one above and the one below each disc supply blood, nutrients, and oxygen, and growth factors, just like the ones you find in PRP, just like the ones that come from the stem cells and delivered often through extracellular vesicles. They come from the cells that live just under that bone and the bony end plate of the disc. Now, what lives in that bone is marrow. And guess where most of your stem cells are, Rico?
In marrow?
In the marrow, right? And if you
Red
ever
blood
known
cells.
anyone that had a stem cell harvest, they got to drill into their bone and get into the marrow and suck it out and spin it down. So I have found, and this, I didn't come up with this idea. I wish I had. It's based on a doctor out of France named Herneglo. And Dr. Herneglo did a knee study over 15 years ago and published every 5 years on these patients. He has since done some spines and other parts. And they found patients, you got to hear this study, your listeners are going to love it. They took people who were recommended knee replacement surgery. I'm sure we all know people have had that, right?
Yeah.
They said, they went to these people and said, would you like to be in our study? We know you need a knee replacement. Join our study and you might not need one. So they signed up hundreds of people and they put them in two groups. Group one was, we're going to inject into the knee meniscus, the gasket, the soft part, which is kind of like the disc of the knee, right? And they took the other group and said, we're going to inject the bone right above the knee meniscus, right below the knee meniscus. And they were using stem cells. And they, every time they published their group of patients, and they got to the 15-year, the group who had the bone injections lasted longer, meaning they did not need a knee replacement. At 15 years was over 80% of those patients who, remember, they were recommended knee replacement 15 years earlier, have been able to do well and avoid a knee replacement for 15 years and still ongoing. The group that got injected into the joint where the meniscus is went about, I think it was about 60-some% of those patients. So that's still real good. They saved these people from having knee replacement. Now, they didn't do a second study where they, as those people kind of needed something, hey, let's try this stem cell again. So this is a path that's going to reduce the need for surgeries of joints and of the spine. So I'm translating this to the spine and running with it. And this is what we're doing, is we're injecting the vertebral bone above and below a disc. And we expect a turning on of the healing genes, a laying down of the collagen and the different types of proteins, the taking in of the moisture in the water and getting that disc squishy again, and rebuilding the cushion. That's the whole premise.
Wow, that's exciting. I think that's definitely what I need. The only thing is, it's still, but all this kind of stem cell therapy is still kind of expensive, though, isn't it?
It's actually not that bad. You consider being laid up or missing work, and we got it down. It's not too bad at all. Yeah, you're right. Insurance doesn't cover this because it's experimental, not FDA approved. But I think we've got it down for a spine, under $10,000 for a disc, and that includes the surgery center, the anesthesiologist, because we do this under sedation, because we got to put a needle in there.
Yeah, well, see, I also need that on my left knee. This is an old football injury, and it's just pretty much bone on bone. And I've had a lot of different things in there, some PRP too that help. My thing is, I'm an inline skater too, and I've been skating for so long, rollerblading, and I every so often, you go down, and I actually, my knee doesn't bend, it doesn't flex very well, so I hyperflex it, and it really stresses it out, but it's still hanging in there. But I always want to ask you this too. It seems like of all the technology we have, we can send rockets to outer space. Why can't they come up with some kind of injection that would just inject in there, some kind of a gel that would just stay there and give us a new cushion in there? It seems like that should be a simple thing.
We're already biologically wired to build that new cushion. It just needs some encouragement at our age. We're not the 3-year-old who can heal a knee like that in short order. But we can have a little bit of that 3-year-old by using these regenerative biologics. So we do have it. It's here, and with time, it's being more and more accepted.
Yeah, well, that's good news. Yeah, well, that's one of the things I always like to tell my clients and people is that that's another reason why it's so important to stay as healthy and as fit as you possibly can, because our knowledge about the physical body and, like I say, regenerative medicine, it's just going up like this, isn't it?
Agreed. There's an explosion right now in biotech, and it's all mostly biologics. It's stem cells, it's exosomes, it's now they have even they've taken some stem cells and programmed them backwards into the stem cells of stem cells, or what we call induced pluripotent stem cells, or iPSCs. And these are growing organs from it. They're using them for cancer therapies. They can program these. I mean, it's amazing what's going on out there. This is truly reversing biology backwards, and back to the cells that are part of an embryo. Yeah,
it all comes down to the cells. And it's interesting too, what I've always learned too, even on the spiritual side, is that isn't it amazing we have all these trillions of cells and they're all communicating. They're all communicating with each other, and they also are listening, to what we're thinking and saying, and all those things affect all what's going on in our body. So there's so many really exciting things to learn and all that. Well, tell us a little bit more about your particular practice. Who are what type of patient do you really like to see? Who do you specialize in, and who do you like to really help?
Well, listen, I think I've learned something about myself that's going to help answer that. And when you're applying to med school, you say, "Oh, I want to help people." We all put that down, right? But I think I really do. I don't think it was just something I say. There's nothing better than the rewarding feeling you get when someone comes in and says, "Yeah, you helped me. My pain is gone," or "I can." If you go to some of my social media, I got a patient who's let me take a video of him. He came in, we did a regenerative treatment on one of the joints in the back of his pelvis called the sacroiliac joint. And he had to quit bowling before that. It took him 6 months to start bowling again. By 12 months, he was pain-free. So it took him a long time to heal, but we were incredibly happy with him. And he was just slowly amazed, and I was amazed and kind of beaming with pride that we now have ways to do that. So my favorite patient is someone who hasn't been helped by traditional medicine. I don't care if it's pain, a joint problem, if it's a diffuse joint disorder like an arthritis, a Lyme's disease. I've helped people with subacute kidney failure. We've helped people with insulin resistance. I've helped people. The one thing that's beautiful about exosomes is it does cross the blood-brain barrier. So people with cognitive and demential problems, we've helped, but mostly the orthopedic group, the knees, people who are facing a surgery they don't want to have, knees, hips, they want to dance again, plantar fasciitis we've treated, old football injuries like you. Acute injuries too. I've got some athletes that see me. I've got some old professional players that come and see me, and then the anti-aging crowd, the biohacking anti-aging crowd, and I'm probably one of those best customers because I also use these products, and I've had IVs and things, and I like to think I'm on the younger side of my age group, but I work at it. I take the right supplements. I exercise as much as I can. I'd like to get more, but you know how it is.
Yeah. Well, I totally understand how you say how so satisfying it is, because it's the same for me, working with fitness clients. So I really like to work with people that are really deconditioned and just out of shape, and they've got a lot of premature aging. And what's interesting, when I evaluate them, they don't even realize how stiff and how bad posture they have, and how their balance is so bad, and how weak they've gotten. And so I just show them a few basic things, and they go, "Oh my God," they don't even realize it. So that's really fun when you can really you change a whole person's physiology and how they can move and how they feel. It's a really rewarding thing.
Agreed.
Yeah, very, very good. Well, I think Well, we've been going here about 40 minutes, so that's probably enough for this, maybe this time, but is anything particular that you'd like our audience to know?
Well, listen, for anyone out there who's got an ailment, a problem, their doctors have kind of said this is as good as it gets, or your labs look fine, even though you've got a problem or a pain or loss of energy, there might be something we can do. I love to do second opinions, and we can do it by telehealth, just like we did here today.
Yeah,
We
that's
do
great.
like to get some information, films and records, and we can arrange all that. But the world is flat these days. We can do this. We can meet with people. I enjoy doing it. We're not in a rush here. It's a concierge level situation. And if we can help just one more person by getting the word out here, or a friend or a cousin or a parent or whatever, please, I love to help people. Reach out.
Yeah, well, again, thank you so much for all that great information and what the work that you do. And yeah, we'll really put your contact information in the notes in the description of this podcast. So yeah, again, just thank you so much for that. It's such an important topic, and just about everybody's dealing with all these things, and it's such a good feeling to know that there's so many things that we can do ourselves, and there's so much new things on the market that's coming that we can rejuvenate ourselves, and we just got to. So that's again why it's so important to stay as healthy and as fit as you can, because lots of things are coming down, and it's going to change everything real quickly. So that's exciting. It's exciting.
Thank you so much for having me.
Yeah, thank you. And so I like to always end all of my episodes by saying, knowledge without action is useless, right? So we always give you some really great information, some knowledge of all of our great experts. So, but you got to step up and take action on it. So I highly recommend. I'm sure just a lot of you are just like me, dealing with lots of different things too. So I really highly recommend you get a hold of Dr. Gross. I think it'll be really, really beneficial for you. So again, you can do it. You just got to step up and do it. So Dr. Gross, thanks so much. That was great.
Thank you, everyone. Be well. Be well. Stay young.
Thanks so much for being here. Oh.